Occupational therapy is a healthcare profession. OTs use individual and specialized programs to help persons who are suffering from both physical and psychiatric disabilities to achieve independence in daily life activities. Occupational therapists also focus on socialization activities, which enables a person to integrate within the community, whether at home, school, or at the place of work. OTs work with a wide variety of patients such as developmental problems seen in children, conditions that affect the brain such as stroke, upper extremity conditions, especially hand injuries, oncology, orthopedic and arthritic conditions, patients with amputations, the elderly, mental health. Occupational therapy services are available in all hospitals in Malta and Gozo, as well as in the community. Occupational therapy services in the Gozo General Hospital are offered to a wide variety of patients from all walks of life. The first step in pediatric OT is always an extensive assessment to establish the difficulties as well as the capabilities of each child in activities of daily living, in education and the learning process, in play and in their personal care. The evaluation is necessary in order to plan a treatment program which will address the problems, whether these are developmental, mobility issues or sensory difficulties. This process helps the OT establish a child's needs according to the stage the child is in. It is always important that the parents are present for these assessments, so any additional information regarding behaviour and difficulties encountered at home and school may be shared with the therapists. The OT program is designed to help parents and teachers to develop new skills in the children. Within the geriatric sphere, the occupational therapists treats elderly clients who live in the community, as well as those who are in a residence to achieve the maximum possible level of independence. The OT helps patients who are suffering from conditions such as Parkinson's disease, dementia, stroke, arthritis, and orthopedic conditions, as well as those showing generalized deterioration affecting their functional performance. In this way, the elderly clients can look after themselves with less help. This is achieved through a program based on the individual needs of the client. Occupational therapy is provided on both an individual basis as well as group sessions. The person is allowed to express himself through creative media, which includes art, pottery, poetry, and music. The use of physical exercise is another important area which allows release of energy as well as helping the individuals to communicate and live together. Clients are prepared for work through vocational training schemes in industrial work, various trades, crafts, and other areas such as IT. General physical rehabilitation is carried out across various hospitals and facilities with the ultimate goal of increasing our clients' independence in all daily activities. Training in activities of daily living is an integral part of the rehabilitation program. These include activities related to personal hygiene, dressing, grooming, and feeding, as well as activities that affect the individual within his home environment, such as performing domestic duties like cooking, washing, and ironing of clothes. It is important for a person living alone to be able to prepare meals. To achieve this goal, the person must be capable of planning the daily meals, as well as using kitchen in an appropriate and safe manner. The OT gives advice on how a client can adapt the kitchen environment to enable more independence, as well as advice on any equipment and adaptations to facilitate the task. Certain conditions physically limit patients and prevent them from getting in and out of bed independently. The OT teaches patients different methods to enable patients to transfer in the easiest method. Other difficulties can arise when the patient needs to dress and undress. OTs are involved in teaching the individual different methods to complete these tasks independently, as well as the use of aids and adaptations such as long-handled aids. A home visit by an occupational therapist is a vital part of the OT treatment program. This can be carried out prior to a patient being discharged home. After a period of hospitalization, the OT assesses the home situation, aids and equipment necessary, or alternative methods to perform tasks as required. This will address the individual's difficulties in coping and living as independently as possible in their home and community. Our efforts are directed towards the client's ability to live independently in the community. The aim is to provide a professional service designed according to individual needs and improve the quality of life.